Good evening to all the viewers who are watching live and will be watching on a recorded version. This is to hereby inform that we are not distributing any kind of certificates, means auto-generated certificates for this CME due to some issues with our internet, and we hope you guide, means cooperate with this trouble. So without wasting any more time, let's just jump on our today's CME with a 30 seconds countdown time.
Good evening, everybody. Uh, we had started way back in June 20 with our online CME. That was the first episode of live CME through YouTube. And tonight we are on the 68th version. We have two very eminent speakers who are there to enrich our knowledge in this continued medical education program. To inaugurate tonight's CME, we have with us our beloved Dr. Pralay Sharma, in charge and Deputy Medical Super of National Institute of Homoeopathy, Kolkata. So I request Dr. Pralay Sharma to inaugurate and introduce our speakers and topic tonight, along with the moderator. Over to you, Dr. Pralay.
Namaskar and good evening. As I have been introduced by our secretary, Dr. Bidyut Mukherjee, that I am Dr. Pralay Sharma. My first identity is I am the first batch BHM student of this institution of National Institute of Homoeopathy. And I'm very happy and it's my privilege to inaugurate today's CME, the 68 CME, online CME from National Institute of Homoeopathy Alumni Association. With due permission from all alumnus located, situated from every part of the country and also abroad, I would like to inaugurate today's CME on online platform. And today we have with us the very eminent speaker to discuss in the CME. We have with us Dr. Narayan Kalyani. He is the president of our National Institute of Homoeopathy Alumni Association, as well as he is a retired research officer of National Institute of Homoeopathy. He will be talking on the subject journey with 300 cases of degenerative joint diseases in National Institute of Homoeopathy. And what I believe is that this degenerative joint disease is the synonymous is of this term of degenerative joint disease is a osteoarthritis. In fact, is a wear and tear arthritis. We will be knowing in a better shape that how homeopathy acts in a non-surgical strategies, how we adopt this degenerative joint disease. And this will be very precious and very informative discussion today. We have also have with us today a very eminent speaker. It doesn't require any introduction. In fact, we have Dr. Sunirmal Sarkar. He will be talking on clinical tips in homeopathic practice. In fact, we will be knowing from him this 45 years of this lifetime experiences, what he has out of his very busy practice. We'll be listening to him, and I believe that we'll be enriched with his knowledge. We also have a very renowned physician as well as research scholar, Dr. Swapan Kumar. He had been working in Central Research Council in homeopathy in the capacity of assistant director. And we are very happy to get Dr. Day as a moderator out here. So, understand without any further delay, I would like to hand over those further proceeding to our moderator, Dr. S.K. Day, sir. Day, sir, please.
Good evening to everybody. Just Dr. Pralay Sharma has introduced everybody about their positions, about their achievements. Here, today, two eminent speakers, Dr. Devnarayan Kalyani and Dr. Sunirmal Sarkar, both are the same batch. When I was the student in NIH as a third batch, and they were the part of fourth batch. And during their student life, they were definitely a scholar and having a good knowledge, fair knowledge. And after that, actual journey starts. That's the professional career. Dr. Kalyani worked in NIH. He has the opportunity to work on the research protocol, research activities, research monitoring, etc. And Dr. Sarkar was initially he had connection with the National Institute of Homoeopathy, and he was an eminent teacher, no doubt. At the same time, he is a professionally acclaimed one, and he does the very good practice, having a good practice. Not only that, he has a very good sound knowledge about the homeopathic materia medica, and so, and he will be the best person to say to the students, to the other homeopaths, to know the other than the basic materia medica. That's the tips of the that is the pointer indications of any remedy which can be used effectively and efficiently. So, first I want to call Dr. Devnarayan Kalyani to speak on the degenerative process and its monitoring and its detail about that, because that number of case is not a little one. It is a 300 case whose pool, that pool itself is a big one, and definitely covering the all type of uh, degenerative changes. So I hope his presentation would be most effective and most important and useful one for the future. Thank you. I call upon Dr. Devnarayan Kalyani to come up and speak the subject.
Thank you, sir. We are really grateful by your presence as an inaugurator. Equally, thanks to our beloved Dr. Pralay Sharma, Dr. Bidyut Mukherjee, all who as backstage editor, viewers, and other persons who are present in the CME. It is my good luck that CME committee has given a chance to present my observations on degenerative joint disease in association of homeopathy, both in OPD and IPD. Of course, it is a very vast chapter that all of us are well aware of it. It is very much shocking that in India, about 10 millions of people are suffering from degenerative joint disease every year. And more unfortunate is that degenerative joint disease by conventional medicine, it is neither preventable nor curable. Simply, it is manageable. Better life can be given, but it never can be cured, neither it can be prevented in any way. So it is a standing problem for not only for the country, but also for the whole world, that progressively elderly people are suffering from a destructive type of disease and becoming handicapped day by day. We are also aware of it, that homeopathy in this world is still surviving with proud for the only one reason, that homeopathy can safely and confidently deals with incurable critical cases, so-called incurable. Not only bone disease, previously we have observed that many pseudosurgical diseases can be easily cured by homeopathic system of medicine. Today we will experience that degenerative joint disease caused by various types of pathological changes in joints and bone can be definitely completely cured with radiological evidences. Symptom, of course, it will go off. Almost all cases. We have not seen a single case where clinical improvement was not found by homeopathic medicine. But many cases, I will try to show you, present you the radiological reports and X-ray plates, which will tell you that homeopathy confidently can cure degenerative joint disease of various types. Of course, we may not be very much happy or may not be very much pleased by seeing this presentation because of certain constraints. The constraints are why I'm telling all this thing, by which you'll be able to consider my presentations. Constraints were, first was National Institute of Homeopathy could not continue research department because it was a academic institution. I do not know by whose inspiration. Research activities was completely blocked. In spite of amalgamation of Central Research Council, which were running nicely in National Institute of Homeopathy, Amma Street building, were amalgamated NIH for the purpose that one of the aim of formation of National Institute of Homeopathy was research. But unfortunately, that CCRH, all research workers, and along with the NIH research workers like me, were utilized in NIH as teacher and hospital or clinical treatments. Means research was completely stopped. That was a shocking news for all of us, especially to me, because fortunately I got the offer during my interview of both the posts, teaching and research. I proudly claimed and accepted research because I wanted to do something. Unfortunately, I could not start any proper research project because of no infrastructure, no fund, no inspiration. Even NIH has got no documents of activation of research, including a single office order. But you may call me that a bad type of personality. That is, I like to move with constraints. Difficulties is my inspiration. So once I got the information that NIH is going to close research, only it will be stick to teaching. I started doing research by my own, completely individually, without any instruction, without an office order. Even protocols had not been sanctioned because there is no fund. A so-called departments are made by the research workers, but without any infrastructure, any fund, any stimulation from any corner. But it was Professor A.C. Day. You might be knowing him. I was fortunate to work with him in outpatient department. By seeing the improvement of degenerative joint disease in OPD, he told me that why don't you put into the press? Why don't you keep all your improvements to the people? Then I told him everything. Sir, we are teaching and taking hospital care, but research is not properly done here. These are the constraints. So immediately he started shouting. By the way, let me tell you one thing. That is, it is fortunate for homeopathy that majority of the inspirers are from modern medicine. This is our good luck. Starting from Hahnemann till what I'm telling of Dr. S.C. Day, he immediately told me, see, research does not require any instruction, any inspiration, any fund, anything. Only one, the mind for searching and to bring out something new to the generations. That is research. Rest will come automatically. You start yourself. Don't bother about other things which is required for formal researches. Whether it is accepted by the scientific world or not, you go on working, put documentations, try to put the documented cured cases before the people. I was very much inspired, and you'll be astonished to know that by 2 pages of table calendar, very small paper, he make one protocol. I asked him, sir, why can I get protocol? We don't have any infrastructure. I have to go to CCRH. There is a long process. Maybe that I may not allow. Then he told me, I will give you the protocol. Just imagine, being a person of modern medicine, he gave me protocol in a very, very small letters, like legs of ants. Very carefully, I studied it, jotted down, and made the protocol, put it for permission, but unfortunately, it is yet to be sanctioned. Anyway, but I didn't stop working on research. First, I started with literal research. Then, by seeing the improvement and getting inspiration from the SC day, I started working on degenerative joint disease long few years back. While I was working on these things, before that, I had to be confirmed that tell you what disease it is. And this degenerative joint disease and its causations, pathologies are not usually not taught in our teaching pattern so thoroughly. That's why what I want to show you a little bit of theoretical information what is joint disease is. In homeopathy, joint disease has a definite role of answer. Management in homeopathy, treatment in homeopathy, and research. Common causes of degenerative joint disease. First is ecology. Where he is staying, how much humid, how much hydrogenated area it is, what type of atmosphere he is facing, etc. Next is ignorance regarding health, diet, and use of body and joints. Majority of the people are not aware of their joint activities, movement of the body, and what diet is necessary for keeping good health, for good movement of the joints. Next factor is modernization. Gradually, it is not by my voice, it was voice of Professor A.C. Day, that we are purchasing comfort at the cost of tension and sufferings. The day more you are advancing, claiming to be modern, the more you are purchasing sickness, purchasing tension, mental and physical sickness. Equally, it is true for joint disease also. That means less work, less activity, lying on soft bed, using of sofa, working on the cushion, comfortable chairs, etc., etc. Neglecting normal activities of the joints. Next is iatrogenic. There are many conventional drugs which ultimately affects the joints through hormones or enzyme disorders. What physiology behind this degenerative joint disease is? Bone, cell, and tissue, how they are. In a brief discussion, we'll try to learn what is cartilage, how does it look like, how it is formed. Then ligaments and tissue, the accessory structures of the joint. Bone, cell, and tissue, it is cross section. It is very clear by the picture itself that a circular pattern of arrangement of cells. In the middle, there are vessels. I don't like to go in details. What happens practically due to the aforesaid causes? First, the periosteum gets sick. Then on those periosteum, these sickness ultimately instigate bone tissue to start wearing and tearing. Bone, shell, and tissue then will go through the articular surfaces. First is subchondral bone, spongy bone, calcified layer, tide mark, deep layer, intermediate or transitional layer, surface layer. Then we look after the cartilage tissue. This is bone structure. We are seeing that two bones are opposed by articular cartilage. Then between the articular cartilage, there is synovial cavity having fluids. Then is synovial membrane, joint capsule. Then is our bursa to avoid frictions. Then we have ligaments, epiphyseal bone, upper portion, enthesis, muscle, synovial bursa, encircled by, and that muscles are becoming tendinous. This is approximately most of the bone structures, especially big bones, big joints. Ligament and tissue. This is structure of bone, multiple layers one after another. In between there are vessels. There is cavity within the long bones where bone marrow is sustained in spongy bone. First bone structure, the periphery means periosteum first gets involved due to three causes. One is unused, disuse, or overuse. Most of the degenerative joint disease, physical causes are these three: overuse, unused, or misused, or disused. These are the reasons to make the bone and joint sick. Structure of bone. Another cross-section of the bones, ligament, joint cavity, contains synovial fluid, articular cartilages, fibrous capsule, synovial membrane. Any of these structures, if they are under strain or not at all activated, ultimately gradually proceeds towards degenerative joint disease. Then cartilaginous tissue and bone disorder differentiation. There is another picture, cartilage and bone. These are the types of joints. We are well aware of it. Ball and socket joint in the shoulder, hinge joint in the knee, pivot joint in the cervical spine and lumbar spine, another ball and socket joint in hip joint, knee joint, average. These are the structures. Because joints are more supposed to activate or exert activity, strain, joints get first affected by degenerative joint disease, and often other bones gradually get involved. How bones work approximately by arrow signs, it has been shown. Pivot joint, how they move by the green arrows. Ball and socket joints, how they move. Hinge joints, saddle joints, condyloid joints, glidings. Most affected joints for degenerative joint disease are weight-bearing joints. First is knee, as per importance, as per area of the joint and weight bearing. Knee is first, then lumbar sacrospine, then cervical spine, then wrist, then ankle, then shoulder, then hip, and then rest other joints. Age and DJD. Due to reduction of the following factors: hormones, STH, parathormone, ACTH, gonadal hormones. In this aspect, I want to tell you one thing, that these hormonal activities combinedly during fracture, within a very short period, within 3 weeks, fractured ends gets regenerated by complex activities of these. Not only the hormones, first the fracture of periosteum and the bone, sensation nerve through nerve practice reaches to the brain. Then from there, through hypophyseal tract, it goes to pituitary, hypothalamo-hypophyseal tract. Then from the pituitary, it goes to the other hormones, like as I told you, growth hormone, parathyroid glands, adrenal cortex, and gonads. Then accordingly, they start liberating, changes the metabolism, calcium drainage, calcium pull, and deposition, calcium and osteoblast cells formation on the fractured ends gets activated in a very short period. In the same manner, if those hormones gets involved in any way, ultimately effect goes on the bones and muscles, the bones and the joints. That is why any injury to the bone surface, including joints, ultimately it will produce different types of bony changes. Then is mineral, that is calcium, it is well known to all of us. Vitamins C, D, and B complex. Nutrients like protein. Calcium cannot be pooled or deposited on the bone for regeneration or improvement if proteins are less in amount. So due to reduction of all these things, there are chances for degenerative joint diseases if they not activate physically and keeps their physiological balance of all these hormones, vitamins, proteins ready. Then is liver function, assimilation, metabolism factors. Everything is all right, but metabolism assimilation is defective by liver. There is chances of bone disease and joint disease. Muscle pull, lack of exercise or exertion. If a single word, if anybody calls, what is the first treatment of any joint or bone disease? The answer will be exercise and exercise. That is exertion. If muscles are contracted frequently, automatically there will be muscle pull. Automatically, that will inspire calcium metabolism to produce more calcium, which to be deposited on bones and joints. Types of DJD. Sharpened articular facet means bony joint areas, they become sharpened like knife. Blunt area becomes sharpened by wasting of the calcium or bones. Reduction of these spaces, this is disorder of the intercostal intercostal tissue, that is cartilages. Reduction of this space. Osteitis, inflammation of the bones in bones. Osteophytes, projection or sparring or growth of bony tissue due to injury. Then sclerosis, erosion equivalent to ulceration of bones, wasting of bones, subluxation. Bones of the joints are dislodged from the area. Listhesis, complete destruction of the bones from their normal spaces due to joint disorders. This degenerative joint disease seminar, it is a vast chapter, not only that, I have number of documents, it will be time taking. So approximately, I have divided this CME, means degenerative joint disease, as 7 parts. 7 phases. Today, the first phase, we are proceeding. Within the 7 phases, we will show documented cured cases of all these 7 items as it has been focused in the screen. That is serpent articular facet, reduction of disc spaces, osteitis, osteophytes, sclerosis, subluxation, lithiasis, etc. All type of disorders in joint disease can be cured completely by homeopathy. Clinically, almost 100%, radiologically, to a very good percent. Why I'm telling that I may not be able to satisfy all of you by showing the documents of all cases in a very good number because of the constraints I was telling, as because NIH did not have any research infrastructure, no funding, we could not convince the patient to report after getting clinical recovery. Majority of the patients in our OPD are very poor, intellectually very low. They do not know their exact fate. They do not want to ask the doctor how long I have to be under your treatment. They are not that much intelligent. The day they get off or they are free from the pain, discomfort, and ability, they stop coming in OPD. Because you know that majority of the patients in NIH OPD are coming from very far distance, wasting a whole day. Whole day labor is lost for the treatment. Maybe the cost of the treatment is very less, but time consuming. Early morning they have to come, and late night they will reach from Murshidabad, from Chabis Pargana, and far distant from Malda. So naturally, we are not able to collect the radiological changes of majority of the patients because of this reason. After getting improvement of their complaints, they don't turn back in spite of request. Then what I decided, they have to show fears. Panic may cause some report in our hand. Then I started telling when you are able to understand the patient and not turning back to show us the radiological improvements. Then I told them that don't stop the medicine despite of recovery. The disease will again come back. Until X-ray is done and X-ray is found to be normal, you have to be under treatment. Fortunately, few intelligent people, they listen to us. Majority of the less intelligent people didn't listen to us. They went back to their home after getting improvement. That's why clinical improvement in OPD of NIH is maximum, rather almost all cases, what I have seen. Radiological documentation has become very less. There is a procedure that if you want to continue research, you have to take a consent of the patient and he will come to you against certain payments. They will be given some fees or some privileges. For that reason, they will come back, they will turn back, even after getting recovery from the clinical complaints that we could not arrange. That is why, simply by showing fears, by making them afraid of the repetition, we are able to collect few radiological data which are very much inspiring. I will try to present you in near future, but we could not we could not do it up to our satisfaction. Anyway, these seminars is simply inspiration to all of us that these diseases are curable clinically, radiologically, serologically. All of us, if we try, all of us will be able to cure. Serpent articular fatigue, reduction of disc space, and you know that all these points are very, very serious, especially reduction of disc spaces. It needs a violent operation as early as possible. Sclerosis is a deadly disease, gradually destroys bone. Subluxation is another very severe surgical disease. Lithiasis too, which is a very serious surgical disease as per conventional system of medicine. Signs and symptoms. Early signs and symptoms are morning discomfort, recurrent pain and strain. Here one point I want to tell you, any of us, any of our family members, any of our relatives, any of our known person, if they complain recurrent sprain or strain in neck or any joint or anywhere, do not forget to get one X-ray because that is the early stage of degenerative joint disease. Majority of the people, even we also usually neglect. We take some Rastock or some ointments, etc., or hot pad, hot application, complaint goes off, we forget. But the recurrent sprain and strain are the early symptoms of degenerative joint disease, including morning discomfort, not only pain, simply discomfort. Whenever we are getting from the bed, my knees are not free to walk. Whenever I am getting from the bed, I am not free of my head and neck. Some discomfort in the waist. That is the early sign and symptom of degenerative joint disease. Immediately one exercise should be done to start the treatment. And those cases will be definitely cured because the case is in the very beginning. Usually when patient comes to us for treatment, they have tried in modern system of medicine. They have taken allopathy medicine for as painkiller. They have taken calcium. They have taken vitamin D. All measures have been taken. All of you know that NIH OPD patients are usually late comers. Means by trying different places, when they are not getting any improvement, then they come to NIH by crossing miles and miles of distance by train and other means. Next is delay recovery of injury. Any injury, whether it is on the muscle or bone or anywhere, if it takes time, long time to recover, it is a sign of degenerative joint disease. Immediately blood and serological study, other serological study, and X-ray is necessary for the affected area. Intolerance of overstrain. In comparison with age, height, and weight, that is BMI. BMI, basal metabolic index. If we find the the activity or strength of the persons are not as par with BMI, then we must have a doubt that patient is going to suffer from degenerative disease. If these 4 points are we can keep in mind, then many of us may be escape from degenerative joint disease in near future. Most of our professions are sedentary type. We used to see patient hours together, whole day, ignoring normal exercise, physical exercise, normal muscle pull. As a result, this thing gradually comes. So be serious from very beginning. Signs and symptoms. Late signs and symptoms. Morning stiffness. Reduction of mobility. Ability and mobility is reducing gradually. Early morning, there is some stiffness. Then mild pain starts, then gradually pain goes on increasing by movement. Then come tenderness, means inflammatory signs of the bone. Then comes swelling. Then comes disability, not able to move. Then comes deformity. So before coming to the stage of deformity, if we are cautious, if we start treatment immediately, many of us and many of our patients can be cured in the early stage from the violent type of degenerative joint disease. All the cases, as I told, needs investigation. First necessity is X-ray. We are seeing on X-ray, knee, cervical, and all the areas wherever there are the previous complaints, we must have one X-ray. Then contrast CT scan. Contrast CT scan will show not only the bone cartilages, but exact picture of the cartilages, thecal sac, openings, accessory tubes, tissues, ligaments. That is more visible in contrast CT scan. Why contrast? Because only we don't want to see only the bones. We are concerned with the joints. So bone and the joints both should be observed by CT scan. Then ultrasonography regarding the joints. Then CMRI, contrast MRI, for final changes for canal obstruction, for slip disc, for neural compression, for thecal sac compression. This serious complaint needs CMRI. Further, the management for these cases usually restriction of movements and posture. Posture movements and posture should be restricted, not stopped. He must be given the right direction, how the movement should be continued, how we will start moving, abnormal movement, unusual movement, overstrain should be avoided, along with postures, in which posture they will sit. Many of our countrymen, especially Indians, due to lack of uh, intelligence and education. We do not know how to sleep. We do not know how to sit. We do not know how to stand. It is very much unfortunate. These things we are not being well trained or well taught in the school or other places for which most of us suffers. Many of us do not know that back rest needs to be straight, sitting area should be firm, that will inspire muscle pull for proper calcium metabolism and deposition. Then your exercise, muscle pull for increasing of muscle pull, all free hand exercises, then active and passive movement. Few exercises should be given by the physiotherapist, scientific movement necessary for the changes of the bone, then passive movement, which physiotherapy himself will show the patient what type of movement is necessary to give rest and proper movement of the joints to get rid of their complaints. For this passive movement only, not only I should say, for this passive movement and advance of the active movement, there is one system of paramedical sciences, that is physiotherapy. There is graduation in physiotherapy. So for these 2 points only, active and passive exercise, how much important it is for everybody, that one course has been made, graduation course, to be taught and to be given to the peoples. Then it died. Body weight and supply of calcium, protein, vitamins, etc. That we should be well aware of it. For this point also, there is a separate course, how much important it is, dietitian course. We need not to consult all the time dietitian, but approximately balanced diet should be taken by all the peoples for normal, healthy bone and joints. Then is thermal control. Few complain to reduce the inflammation, to reduce the pain, suffering, nerve sensitivity, ligament stress and fear. Some thermal applications gives relief, cold or heat according to necessity. Then what homeopathy says? Homeopathy prescription, very, very important. All of us know it. Evaluation, repertorization, and finally Medica for individualization. By this point, I want to tell you the cases I will show in near future or today itself. You will find all the cases were covered by these 4 points. And we found that single drug, individualistic approach was the answer for radiological changes, for getting cure of the patient radiologically, not only clinically. I told you one day in last seminar that I had a trial with 3 drugs on spondylosis, hypericum, and Barani on 200 cases, and rest cases were continuing by this conventional individualistic drugs. It has been recorded that not even a single radiological, not even a single case given by the symptomatic prescription got radiological improvement. Only 35% cases got clinical improvement, not even a single case radiological improvement. But by our traditional system of prescription, Hahnemannian prescription, totality injury prescription, number of patients we have seen, radiological changes, radiological cures, and almost all cases, except very few for unusual cases, clinical improvement. Homeopathic medicines are usually palliatives. You all know this thing. I should not tell these things regarding in presence of Dr. Sarkar, my sincere dear brother, because I am very little brother to him regarding Medica. Still, what I have experienced that palliative medicines, when the severe complaints are there, patient not able to continue the treatment for his pain, simply for the timing, after having detailed case history and final prescription ready in hand. That means case taking, evaluation, repertorization, medical consultation, my drug, my final weapon is ready in my hand. Then I can play drama with the palliative drugs to give little pain, little relief for the timing by ginseng, guaiacum, magphos. Palliative and curative. Same thing I told you, as per severe necessity, where patient may not continue your constitutional drug due to complaints. He will go back to other system of medicine, or he'll be fed up to be treated. Though this type of uh, difficulties, constants are less in NIH OPD because patient after coming in NIH OPD, they automatically gets confidence by seeing the number of patients and very big output and sincere effort of the doctors and other attendants. They get confidence. They continue their treatment in spite of no improvement for a long period. But for private practice, for the beginners, this is a great problem. If within first or second prescription you cannot give any changes, then patient won't come back to you. He will go to some other doctor. For these reasons only, I am not inspiring palliative prescriptions. I am not inspiring symptomatic prescription, but inspiring for the braid only for survival. If at all necessary, you can think of this drug, but never, never without being confirmed regarding the drug of the patient. They are palliative and curative. To some extent, they are curative too. Abrotenum, acid benzoic, Actias picata, Apis magnifica, Argenta metallicum, Arnica, Belispar, Bryonia, Calcarea fos, Calmia, Ledum, osteoarthritis, Phytolacca, Pulsatilla, Rastox, Silesia, Leading bromide. Then mathematic, constitutional, or individual drug, any drug. We have learned from aconite to ginkgo. Any drug may come in the picture. But what we have seen, many cases, these drugs comes. Don't consider that these are the drugs for mathematic prescription and constitutional prescription. They will cure all the cases. Never. I will show you the documents. Ora metallicum, bacillinum, calcarea fruit, causticum, carcinosin, lycopodium, medulinum, sulfur, thuja. Rare drugs. Abrute, Arania diadema, Elater, Leute, Macrotin, Olean jacurix, Profil, Stellaria, Viscum album. Most effective drugs, what I have experienced in 30 years of experience on treatment research in joint disease of homeopathy, they are the following. Arania, Belispar, Bryonia, Calcarea fruit, Causticum, Ledum pearl, Lycopodium, Macphos, Medurinum, Rastrox, Radium. Now research on joint disease. In National Institute of Homeopathy, under Minister of AYUSH and Government of India, I told you there are constraints, but as a person, I am very hardliner. I usually never compromise with anything. In spite of having no means of research, I tried to continue my level best to keep documentation as far as possible in the form of research. I will try to show you few documents. This was the first publication on joint disease, January 2004, volume number 7, number 1. That was containing 9 pages of publication simply on clinical study on the joint disease. This was the first page. Abstract was, this is a brief research project on clinical studies on about 189 cases to observe the effects of homeopathic medicines on degenerative joint diseases Author studied as chief investigator under the project officer director in NIH undertaken this project for last 4 years. Research work was done on new and old selective cases, radiologically diagnosed cases only for outpatient and inpatient Department of National Homeopathy, Sholday, Kolkata, under Department of AYUSH, Minister of Health and Family Welfare, Govt of India. The entire study was done in Department of Research along with assistance, advice and consultation with other allied departments of NIH. I will not go through all the pages and all the points. There are many formalities regarding publication of research article. I will not go through it. Simply, I want to bring to your notice our aims and objects. These are all in the left side, they are all the formalities, name of the project, etc. The aims and objects of the research project was to assess clinically the effect of homeopathic medicines on degenerative joint diseases, to evaluate the great value of effectiveness of homeopathic medicines in reduction of signs and symptoms, to give short and long-term relief in sick patients who are suffering from DJD, to assess the best suitable of the application of homeopathic medicine to the disease as cold treatment without any iatrogenic side effects, to assess the improved state of life for DJD patient, to assess the radiological and serological changes. So our first aim and objective was simply clinical. If incidentally we can observe the radiological and serological changes, that we will observe. Rest are formulated of the research articles. Here I want to simply show you the detailed work done during this period and improvement data. Though this was not very mature research paper, we are very beginners, plus there was no means of proper research work. Still up to our level best, we did these things. You just observe these are the data and columns. You just observe the B point, improvement of symptomatology of degenerative joint disease after application of homeopathic medicine, pain in the joints, 75% improved. Morning stiffness, difficulty in movement, mobility, 75% improved. Inflammation, pain, swelling, redness, 80% improved. Deformity, 25% improved. Working ability, 75% improved. You will surprised to see, we could not document at that time that deformities are improving also along with the clinical complaints. Other accompanying symptoms, other accompanying complaints are 80% relief. This is another mystery of homeopathy. Homeopathy treats many diseases by one system, one treatment. Means we treat many diseases by one treatment is homeopathy. Number of accessory complaints usually patients have, they got relief automatically when we are treating the joint disease. Not only that, constitutional treatment, automatically the other accessory complaints for which patient complains or not, that will improve. These are different formalities as I told you. Then the last page, the discussion only I want to focus. These are pie charts. We will simply see how far claim was successful in relation to the patient, discussion and final assessment. This is to be brought to your notice that degenerative joint disease in a global problem of elderly people's hypokalemia, overweight, sedentary peoples are more victim of degenerative disease. All patients were collected from OPD and registered in research department after confirming the case from radiological reports. Only clinical trial was considered in this project, hence radiological follow-up was not done. In the next phase, radiological and serological improvements must be considered. Majority of the patients with pain started improving within 15 to 20 days. This is to be marked within few days, 2 weeks. follow-up treatment and new cases registered are being carried out for final assessment. So this is the first publication where we found documentarily patients are improving. Today time is limited, so I don't waste maximum time because Dr. Sarkar is there. Rest of the publications and documentation I will try to show in the next phase of next video. Thank you very much for the day.
Thank you, Dr. Kalyani. Dr. Kalyani has says his whatever the infrastructure constraint to conduct the research work on the joint diseases. First of all, actually, any research work, being a research worker, you may be a passionate to do something, try to find something, make a solution, and try to get the solution over the problem. That is the that is the desire of the persons. It is essential. Then the question comes the infrastructure. But you cannot deny the infrastructure. If it is not there, how you will conduct the best proposal, best protocol, best number of patients there. Everything might be there, but there is some infrastructure, some fund means budget is must. Otherwise, it is too difficult to conclude or to continue the study effectively and getting the best of result. So my request is that he is unlucky in that way that he could not get proper support from the management, from the authority of the NIH. That's all. And another thing regarding this subject, I want to say he has touched all in detail from the very beginning: type of disease, nature of disease, its classification and category, everything, involvement of the tissues, bony tissues, all are what are being involved to develop the degenerative process to continue having the problem in severity. It is there. He has shown that one in details, as well as very prop. This post PowerPoint presentation was very nice, very clear, and the pictures are very much effective one, and it gives a proper identification of that. Because I have observed that even the radiological, the views, whatever is seen, shown, and that is very much clear, and it shown everything in detail. Very difficult to get that type of picture, particularly in the presentation, when PowerPoint presentation. Anyway, I appreciate his work and his presentation. I liked, and definitely I hope in the subsequent phases he will disclose the other things, but in detail, please. Because what happened, say for the patient, maybe a symptomatological, but they are different type. Your 300 patient, which covers what are the regions being affected. That way, some statistical value, some statistical data is necessary to highlight what type of 300 is okay, but the different type, different numbers, different category, everything, please highlight that one. Otherwise, what happened now? And the same time, whatever the medicine you have given, how many are symptomatologically effective and how many are radiologically effective, definitely by maintaining the constraint that requires, because otherwise whatever you say, that value, unless it is specific and projected, it will not be a very uh, appreciable one. So I want that you cover all those things in subsequent presentation and subsequent phase. That will be the best one, and I hope you will do all necessary things. Thank you for your effective lectures. Thank you. Now, Dr. Sarkar, I hope he is ready to present the further presentations. Thank you. Please, Dr. Sarkar.
Namaskar. The question in front of me that how I will start my lecture without PowerPoint. Time is too short, and after listening Dr. Kalyani lecture, actually I am also overwhelmed, and I wish that Dr. Kalyani will not mind that if I add few medicines in case of osteoarthritis or degenerative changes, because I know he is the most experienced person among the homeopath regarding treatment of degenerative diseases, but we are also treating fuse, and some of you know that as Dr. Kalyani has told, the palliative treatment, curative treatment, a smaller remedy. Here I add little bit more. Yes, palliative, curative, or even a smaller medicine, whatever categorically we are dividing the medicines, but if we really know how to use the medicine, that is the mental aspect, physical aspect, modalities, if we really get, most probably we can do more with the smaller medicine, so-called modern medicine. Just I am giving some examples. Joint pains, lumbar pains, pathology, okay, definitely it is gross pathology, but better by standing. Lumbar pain better by standing, just opposite of sulfur. And yes, I get these cases, and from my just what should I say, that is a case takings or case presents. I can remember that case, and patient is telling that today at the present moment in Thakurnagar it is raining and cloudy weather, and patient is telling that cloudy stormy weather, it aggravates my pain. So if we this get two modality, and if we go through the past history also, that history of epistaxis or hemorrhagic diathesis, definitely that patient I am telling cured symptomatically and the radiographically with melillotus, because we know stormy weather aggravates like rhododendron. This is one of the medicine for the rheumatism aggravates stormy weather, and standing aggravates. Standing ameliorates. We know that melillotus, creosote, and argentum nitricum. So by this way, even the smaller medicine can give better result. Symptomatic relief, okay, at the age of 60, 50, 70, even if we give the symptomatic relief, patient is in a smiling face, patient is telling, yes, I can walk, I can go to the staircases upward and downward. What more we can expect from our medicine? Like this, Dr. Kalyani has told arnica and Belispar. Here, with his permission, I am adding another two injury medicine we rarely use. But I got too many, yes, unbelievable result, especially regard from the players, the basketball players and footballers. They are habituated with a spot jump, and after the spot jump, a sprain of the ligament or the knee injury, ankle injury, a spot jump injury. Generally, we can think of arnica, okay, we can think of ruta, okay, we can think of calcarea foss injury medicine, we can think of strontiana carp, no doubt. But remember, doctor, this spot jump leading to a sprain, leading to pathophysiologically grave condition, Dipsicus sylvestris. I still remember the true basketball player of Japan and in India also, they are highly benefited when the sports medicine and other exercise, this and that, it fails, and with our homeopathy medicine, they are still playing. Number one. Number two, that is sprain, ligament tear, degenerative changes with stony formation, stone forming, that is lithic acid diathesis, kidney stone, along with this type of degenerative changes, we may think that the plant which contains maximum silica, Equigetum arvens. Use it, what I am telling, and definitely you will get that what beautiful result we can get. Like this, another small medicine apparently from Allen's boric materia medica, that is Hura brasiliensis. But if we take the mental aspect of the Hura, if we take the repertorial analysis or the repertorial rubric of Hura, cracking sound, so definitely it is a degenerative changes, cracking sound going upstairs, cracking sound going downstairs. The only medicine is covered by Hura brasiliensis. And not only that, if we go through Kent's repertory in mind section, bad effects of grief, ailments from grief, that is also Hura brasiliensis. Especially I am telling for the older persons, especially suddenly separated from son or daughter due to marriage, or son left to some other places, this separation, psychologically, if we think that son and daughters, actually they are the stick on which we can stand on the old age when they are separated. Just like the Hura brasiliensis, it is a gum, extend, it is separated. It is little bit philosophical thought process, but grief, sudden separation from the sons or daughter, since then knee pains or gradually knee pains or inability to walk, other pathological symptoms are coming. I prescribe Hura brasiliensis, and unbelievable result we are getting. That cracking sound disappears, but not in one day. Pathological improvement. So we have to know the medicine in different way, and I am 100%, as Dr. Dey has telling, Dr. Kalyani is telling everybody, that individualizing symptom at the present moment, that will guide to prescribe the proper medication. So this is Hura. Like this, patients are coming with knee pain. Doctor, extending my leg, I feel better. Flexing my leg, I feel better. In Kent's repertory, if you go through, you will get Ferrum metallicum is the only medicine flexing ameliorates, extends ameliorates. Like this, in acute condition, Dr. Sarkar, please do something, I can't flex my leg. In acute condition, sometimes this type of symptoms we have to handle. And basically, constitutional symptom, too much collective symptoms may help, may not help. But with this one symptoms, we can do at least palliation. Yes, you can think it palliation, but patient is happy. At least patient can sit on the commode. Remember, flexing knee, impossible. The only medicine in Kent's repertory is physiostigma. So injury followed by this of flexing inability, we can think this group of medicine, provided it is also very good medicine. You know that physostigma is one of the best medicine for the injury also. Injury leading to tetanus, like that. So many things are there. I am not going into details. But now the question comes, if we is it possible that only one symptoms will help? Dear doctors, that depends on what symptoms we are taking. That is the thing we have to realize, that sometimes the central or pivot symptoms, along with mental aspect, physical aspect, modalities, if we get, then definitely one symptom picturize the entire case at that moment. I am telling at that moment. That is, further symptoms may need, that is the miasmatic or defecting medicine, or rather you can say constitutional medicine. But even it may so happen that if we really go through, that if we really able to pick up the central symptoms at that moment, definitely patient we can prescribe that medicine. The example, I am not going into details, but please go through Ithuja Synopium of Kent's writings, that how one symptom is enough on a repertorization, or 2-3 symptoms are enough on or for repertorization. He has described very nicely. That is the keynote, red line, central, whatever it is. But sometimes it needed, and more we know the medicine from different angle, then we will realize that how little we know regarding the application of even a smaller medicine, not only the polycrest medicine. Now, simply I am adding one thing more regarding this rheumatic complaint to Dr. Kalyani's lecture, that he told very nicely that the hormones and some modern medicine can causes degenerative changes. Here, I am giving my own experience, that if we go through Goodman-Gilman's pharmacology, very nicely, they have described that estrogen directly controls osteoclast and osteoblast. Remember this, what I am telling, that estrogen directly controls osteoclast and osteoblast. So, in case of giant cell diseases, osteosarcoma, more the history of contraceptive pills used by mother, and at the present moment, son or daughter is suffering from this type of osteosarcoma, giant cell or tumor. Think of estrogen in higher potency, 1M, 10M or whatever it is, and when calcarea phos, ruta, and your calcarea floor, silicea, that is medicine which has a special affinity for the bones, is not working or partially working. This is my own experience, and I have seen beautiful results with application of the estrogen. So I think that is enough to add something to Dr. Kalyani, because I learned every day, I am learning from his lecture, and really it is very difficult to explain anything, especially pathophysiology, in front of him, because honestly speaking, I have no hesitation to confess that he is my teacher regarding pathophysiology. I have learned so many things. Beautiful teacher, beautiful speaker. Now, let us discuss some smaller medicine, not a smaller, some medicine, as I told, how little we know regarding the medicine. Let us discuss one medicine, what Master Kent has told very nicely. This is a neglected remedy. This is a neglected remedy, and we should read constantly. And in the last chapter, last paragraph, he wrote very nicely that for understanding this medicine and to use this medicine properly, we should go through the proving symptom, the last paragraph. And if you really able to exercise or use that proving symptom, then you can cure lots of diseases which is not written in Materia Medica. Please go through, and definitely those who are the deeper student of Materia Medica, definitely you can understand that what I am telling, that the name of the medicine is ammonium muriaticum. Some of you know that this medicine was proved by Master Henneman and including other his students also. Now, what he is telling, that if you go through in a deeper way in proving symptom, dear doctors, especially those who are listening, this is one of the sheet anchor in my treatment, especially for the malignant conditions, malignancy of the stomach. Not only that, other condition. Now, what he is telling, the first line in Hahnemann's writing, lugubrious, the word he has used, lugubrious, that is sad and despondent. In Bodic Materia Medica is written that weepy but unable to weep. But most, if you go through the other Materia Medica, yes, weeping disposition. But in, I don't know, because I try my level best, the source where from Bodic has wrote weeping but unable to weep. But in Allen's Encyclopedia, heading, or even in non-Materia Medica, I am not able to find out that symptom. Anyhow, that sadness and bad effects of sadness, sorrow, grief, if you go through. So mostly in this condition, we prescribe Ignatia. Mostly. But so many competitors are there. One is ammonium muriaticum. And this grief, along with eye symptom, that floating points in front of the eye, the second line of Hahnemann's Materia Medica, that is chronic diseases, if you go through, there we will get that if you combine these symptoms, not only that, during coughing, stitching sensation of the right shoulder, it is a gem to cure lots of incurable eye diseases. Please go through what I am telling, and my earnest appeal to the younger generation, or even those who are practitioners, those who are not using this medicine, think this ammonium muriaticum, because ammonium muriaticum is the medicine generally prescribed for sciatica, sitting aggravates, lying down ameliorates. That is one. Cold sensation in between the shoulder. Yes, I can remember one of the clustens tumor, gallbladder, common bile duct tumor, we prescribed on this symptom only, that is the cold sensation in between the shoulder plate. But apart from that, if you go through Bodic Materia Medica, that bitter vomiting with cancer stomach. So even the adjectives, if you go through line by line, word by line, the visualization of the medicine will be little bit different. And more we know, more realization will come regarding the application of the medicine. Like that, another medicine we use, and this cracking sound, as you are telling, that every joint during movement cracks, angustia vera. But if we go through Clark Dictionary, there you will get, this is the medicine is combination of Nux vomica, ruta and marsol. Irritability and crossness of the Nux vomica, timid and cowardness of the ruta, and thirst of marsol, if we get these three in one medicine, that is Angostura vera. So this cracking noise or the pathology, along with this mental aspect of the three medicine, if we get, definitely it will act deeply only on the gap, only on the symptoms, which is totally pathological, that cracking noise, I think. But if we get the mental aspect, if we get the modality of the ruta, if we get the too much thirst of the Marxall, I think then we can picturize this medicine in a better way. And one thing I can tell, this medicine has a very peculiar vertigo. If you walking at the side of a river, pond, there is a thinking that observing the water, he is thinking that he may sink in the river, he may sink in the water, just like our hydrophobium, ferrum metallicum, that when they are walking over the water or breeze, peculiar sensation comes. But this is one of the medicine. Please go through Henneman's writings on this, the first, second line, the peculiar vertigo. Peculiar vertigo. So every time more we read from different Materia Medica, as Dr. Day has told very nicely, that knowledge from one medicine, one Materia Medica is not enough to identify for the understanding of the Materia Medica. And not only that, even understanding of the word is very difficult. Very difficult, because when we have observed different activities of Dr. P.C. Pal, Dr. M.M. Datto, Dr. Dubey, that how keen and sharp observation with the knowledge of Materia Medica, how they apply. And that is the beauty of the Materia Medica. Just I am giving, because to the audience I am telling that selection of Materia Medica or the application of the Materia Medica, of the knowledge of the Materia Medica, it cannot be linear. It's a phenomena. Ups and downs, symptom changes, or my angle of prescription, Dr. Dey's angle of prescription, Dr. Kalyani's angle of prescription. Apparently, homeopathy doctor says that prescription differs, but if we really follow the homeopathic organon, philosophy, law, most probably all prescription will be the same at that present moment. A starting point different, selection different, but we really think in a such a way that prescription have to be one. It's science. Just I'm giving that how this type of analysis we have shown, we are showing in our real life. We know the recent pandemic, so many things happens, sad incidents happen, and mostly we are observed and lots of mental trauma after death. Two brothers died, sons died, and mostly it is a rule that we prescribe ignitia after mental trauma. But we should observe that whether there is a long grief or not, or any contradictory symptoms present or not. That simply I am giving during that period, I think 21, our NIH, just 4 or 5 girls come to me that they are in a PG hostel, and that the PG hostel owner, the lady, lost her child during COVID, due to COVID. What happens? Lots of ignitia last 14 days, it was given in different potency. Now, they are bringing to me that lady, that what sir, please do something. That patient is insomnia, gloomy, sad, unable to talk, unwilling to talk, depressed, and we have prescribed this medicine. Then when I took the case, very beautifully we have observed that last 14 days after the death news of the son, when just she heard, after that getting unconscious, and later on no bowel movement for last 14 days. So that was the reaction after grief. Now let us see melancholy with obstinate constipation. And oleander was prescribed in 200 potency. And within 12 hours, that lady passes stood, and that oleander was enough to minimize her sadness, melancholy, gradually. She able to perform her all activities slowly. So this understanding, or the, what should I say, that understanding of the word, when to prescribe, how to prescribe, that is the art portion. Like this, still I can remember that the two sons died in COVID, I know, and both the sons are really brilliant students, they died. And patient, definitely father, you realize what should be his mental picture. Unwilling to talk, just when we observe the patient, unwilling to talk, extreme sadness, extreme melancholia, highest possible melancholia. If you go through the line, then you will realize that what Borik has mentioned very nicely. And when we are asking what happens to your son, what is it, then all of a sudden he raised his voice as if he has awake from the sleep. Rajani shouted or scolded me, why you are asking so many questions? Whether your medicine will bring my sons? So I think that is enough to identify, and definitely my senior doctors or those who are doing philosophy, that is psychology in homeopathy, please go through selenium, unpardonable melancholia, and 2-3 words are there, extreme sadness. And honestly, when we prescribe selenium on that ground, slowly, it took nearly 3 months, because this type of mental shock, it is very easy to cure on the slide, but it is very difficult. But slowly, the father regained his personality, or the past, gradually forget the incidents and become, I'm not telling normal life, but definitely adjustable with the society. So this type of understanding is needed, and which is known as you are telling, that spot selection or your keynote selection or the tips. There is no clinical tips. Please go through Materia Medica and try to understand. Then you will realize, every day go through Materia Medica, different books from different corner. Then you will realize that there is no clinical tips. At the present moment, make a symptomology, or from one symptom from mind, one symptom from repertory, one symptom for the concomitant, one symptom from your aggravation, amelioration, and definitely then you can get that everywhere there is tips, that is by which we can draw a picture. Just I'm giving a good example, that I don't know that how many medicine we can cover. In Allen's keynote, nothing is there regarding Ferrum Metallicum, regarding throat symptoms. But at the present moment, I think Ferram should be think of, as I told regarding the case of rheumatism, it should be one of the medicine for the aphonia, for hoarseness of voice, because nowadays the persons, those who are really anxious, extremely anxious, fearful, fretful, like arsenic album, doctor, what happens? I can't speak. Is it not cancer? Are you sure that it is not cancer? Doctor, are you sure that I will not die from this throat complaint? So this type of mental makeup with aphonia. Doctor, depression with aphonia. Thought process dying in case of aphonia. Anxious in case of aphonia. Everything is covered by ferrum metallicum. But how many of us we are using ferrum metallicum in case of throat complaint? Mostly aramtriphyllum, causticum, phosphorus, Sina, Isculacip, these we are prescribing. So more we go through different books. What I told from for regarding the ferrum metallicum, that is from NAR repertory. NAR repertory. So every day this type of thought process we have to bring to become a better or successful prescriber, because learning is a continuous process. We have to learn every day from the patient, from the contemporary doctors, junior doctors, senior doctors, old books. That is the only way by which we can criticize ourselves. I am telling, not others' prescription. We can prescribe ourselves what the wrong I have done. Would I have been acknowledged this medicine previously? Most probably, I might have been able to treat that patient in a better way. So I think it is better to criticize my own prescription, not the others. Now the question comes, because this throat, ferrum meta I am telling, the two medicine, causticum and ferrum metallicum, causticum and phosphorus, these are the two medicine. In reality, it is very difficult to differentiate in clinical field. Why? Both the medicine are tubercular, that is miasmatic, tubercular, miasm. Both the medicine are sympathetic to the power infinity. Sympathetic. Both the medicine has craving for salt. Both the medicine is famous for rawness, soreness, burning sensation over the throat, and the rawness. Both the medicine, in case of causticum, cough better by drinking water, and phosphorus itself drinks cold water. Both the medicine has evening aggravation. Now, how to differentiate? Very nicely, Dr. Shelton has narrated, which is known as Shelton differentiation process. Ask the patient where your rawness, soreness, and burning is there. When patient tells and showing the throat with one finger, this is the rawness, linear burning sensation, rawness sensation over the throat indicates causticum. And when patient shows that instantly broader area with 2-3 fingers. Prescribe phosphorus. Those who are very much interested, please go through Pierre's plain talks on Materia Medica. There, very nicely, he has differentiated with this Shelton's thought process. And I have verified these symptoms repeatedly in my life. It will save the time. And it is a 250 years experience repeatedly verified. Do it and you will be enjoy it. Now the question comes, a smaller medicine. Again, generally in case of a sprain, we prescribe Rastox. Definitely, Rastox is the medicine, no doubt of it. Just try to bring something from the upstairs. Then a sprain comes in Valence keynote. It is very nicely written. But dear doctors, have you gone through the first line? The tornado, the first word most probably. As if my brain is going into pieces, divided into pieces. just like glonoine, it is one of the medicine. And remember, in my practice, most of the time, after Rastox, instead of prescribing Calcarea cup, Calcarea fossa ruta, most of the time I prescribe Carboanimelis, provided a strong family history of cancer or extreme weakness, profound weakness. Weakness is the keynote indication of Carboanimelis. Now, from the pathological point of view also, we know that all carbon group can antidote the homeopathic point of view, that nicotine effect. And nicotine effect, now let us see, if we go through the Kent's repertory, drawing pain, calf muscle during walking, the highest is Carboanimelis. And most probably, dear doctors, apart from Nux vomica, nicotine, Cupra metallicum, causticum, whenever it is the starting point of the Barger's disease with a smoking, start with Carboanimelis and you see the result, because I have verified several cases that ultimately within a span of 2 weeks, 3 weeks, patient can walk longer after the application of Carboanimelis. This is one. And Carboanimelis is the medicine. Do you believe it not that it is a peculiar concomitant symptoms if you get in cancer, diabetes, headache, whatever it is, runny nose during eating, coryza during eating, Carboanimelis, Trombodium, these are the two medicines. You can think, but Carboanimelis, that is after psychological trauma, that is neurogenic diabetes, blood sugar may shoots up to, yes, in my that is experience, that it may shoots up to 600, 700. That is psychology. Suddenly it appears, and with this runny nose concomitant, it has come down. Do you believe it or not, that within 2.5 months it come down to below 190? It happens. It is not a story, but whatever we are telling, that if we really able to apply our Materia Medica scientifically, methodically, not on one symptom, but because I am telling, though I am telling one symptoms, other symptoms must corroborate, either physical weakness or whatever it is, peculiar dream, peculiar gesture, posture, But just for lecture sake, I am telling that these are the keynote indication very nicely you can think of. Now, one of the medicine let us discuss one neglected medicine what Master Kent has elaborately explained, but not in Allen's keynote or Boric Materia Medica. Dear doctor, sometimes in clinical practice, we face menorrhagia, metrorrhagia, very difficult. Nowadays, PCOD, rather we can say it is a very common disease, not common diseases, rather PCOD or menstrual irregularity. It is the normal phenomena, and normal menstruation, it is abnormal one. So, menorrhagia, metrorrhagia, hirsutism, amenorrhea, so many medicines are there, so many problems are there, but very rarely we have think what Master Kent has narrated very nicely. Sabina-like clot for 6 weeks, prolonged menorrhagia, profuse bleeding. So we cannot stand like China, peacock, sickly cord. Because at least I faced lot of problems to control this type of bleeding, persistent bleeding for, I'm telling, months together or cycle together. It is very, very difficult, especially PCOD cases. All on a sudden menstruation, no amenorrhea for 2 months, 3 months like this way, and then all on a sudden bleeding, and who is unable to control with your sickly, Thalassoversa pastoris, China, pulsatilla, so are other medicines. But along with that, take the history, that patient is basically very chilly. So like Silesia, like Suriname, like Thuja, like cyclamen, like Aristolochia climatitis, chilly patient, Agarica, chilly patient. So like this, when this chilliness is predominating and thirstless, and at the present moment when patient has come to you that nearly pitting edema, that is hypoproteinemia or due to less hemoglobin anemia, pitting edema, and Master Kent has told very nicely the role of apocyinum. How many of us are we thinking apocyinum in case of menorrhagia or metrorrhagia? Please, please, please go through Kent's writings. There you will get that most probably we may able to treat lots of women with those who are suffering from this type of a combination of Sabina and China, or Sabina ipecac, or Sabina sickle-cord. This is the combination thought process. Most probably we have to think, and for your, I think I have shown this case repeatedly even in NIH, that a metastatic brain abscess with pregnancy, unconscious for 7 days, and later on with this apocyinum 10M followed by zincum, that cancer of the brain totally disappeared, and the lady delivered a normal baby. Definitely that case is already 5 years old and still we are observing. So apocyinum is one of the neglected medicine. Keynote, here also you can go through the one eye vision lost and another eye nearly dim vision. That is one of the case. Like this, euphrasia is one of the case. I think first line or third line of the Allen's keynote. Bad effects of injury. How many of us we are thinking these bad effects of injury and euphrasia? Yes, I can remember one of the case that the lymphoma of the right eye with history of 10 years ago, there was a severe blow, and I started with the euphrasia, not symphytum or not the arnica. And the patient is gradually, this lymphoma slowly. Now it is 7 years. the nearly disappeared. It is so Dr. Materia Medica understanding and Materia Medica reading. I think it is two different things. Very rarely we go through or the in between the lines. Very rarely, but more we are reading every day, and more meaningful thought process is coming regarding the application of Materia Medica. Like this, just I am giving another good clue because time is very short now. How many of us are using calendula in case of apprehensiveness? Definitely those who have gone through Barnett's writings, that a singer, a performer, just like lycopodium, what I am telling, starting to performing anything, she developed sweaty palm. And with history of liver diseases, sweaty palm, apprehensiveness, it is not lycopodium, it is not silica, or I am not telling argentum nitricum, it is very hot patient. Always think of calendula, and most probably you will see the result. And it is really a gem for acidity, heartburn, flatulence, dyspepsia. Whenever acidity takes place, horripulion, that is the erection of the hairs during acidity. I have verified this case repeatedly, and it is really a polycrest in my hand. Now again, I am giving a good clue. Tinnitus aureum, tinnitus. Not only this, ear discharge, left ear, right ear, humming sensation. Do you know? Definitely some of you know, those who are good prescriber, they are knowing. In our Materia Medica, magnesia card takes more than the highest possible pages is written by Clark in his Dictionary of Materia Medica, the ear symptom. Please go through. My earnest appeal to you, then you will realize that what we are not using, and I think we should feel sorry for it. And more you know magnesia carbonicum from the in K. Clark's dictionary, then we will realize that yes, so many ER diseases can be curable with magnesia carbonicum. Now, as Dr. Kalyani has told, again I am telling, but it is not actually the osteoarthritis, but the flying, that is shifting rheumatism, migratory rheumatism. The first or second line of the Boric Materia Medica, that Apocyinum andro. It is most curative result has been shown by this medicine. Most curative, dear doctors. Just what a word Boric has used. Feel it. If it is chilly patient, pulse, very slow pulse, because slow pulse generally indicates calmia and apocyinum, 40, 45, 6, more than less than 60 like that. So take it, slow pulse, migratory pain, chilly, and along with that, what Boric has not added, I am adding from other books. It is really a gem. Chronic hepatic disorder, and if you go through other books also, cholangitis, cholelithiasis, especially it has the special affinity for the common bile duct. By producing the spasm of the common bile duct, remember that then only bile secretion it can be improved. So this, it has a special affinity for the common bile duct, growth, stricture, that is one, and competitor is another medicine I am telling. Very rarely, in neither in Allen nor even Bogart. It is written, the most medicine that is competitor other medicine we are discussing Asclepia, that is Angostura. Sorry, I forget the name. Anyhow, I'll discuss. That is one of the medicine. Pathologically, it has produced tumor in common bile duct. So, if possible, I will tell later on because my mind is now most probably betraying. Now, another medicine I am telling regarding this common bile duct growth, Cladstein tumor. Think another medicine, chlorpromazine. Please go through. Just I am mentioning very quickly. Julian's new remedies, jaundice, gallbladder. How he has described the medicine for the modern era. Two medicine he is telling. One is your chlorpromazine and another is Apium graviloens. Apium. Apium is the medicine, and another medicine, those who are competitor of the phosphorus. Apium is one of the medicine. Remember this Apium and chlorpromazine, because nowadays lots of patients are taking this medicine, hypnotic medicine, sleep induced medicine. In potentized form 30-100 with hepatic involvement. Now, most probably I have to finish because time is not permitting. A peculiar case, dear doctors, most of the homeopaths are treating diabetic ulcer. Two medicine I am mentioning here. In N.M. Chaudhary's book, very nicely, he mentioned a medicine that in case of gangrene, it is the combination of arsenic, silicon and lachesis. That is better by cold, better by heat. Sometimes at the terminal stage, what Boninghasen has told and the homeopathic philosophy is telling, that at the terminal stage, most of the time it is lacking modality, or it is different types of, rather different modality, and which is showing each other antagonistic modality. So, sickly better by cold, arsenic better by heat, lachesis better by cold, hypersensitive, night aggravation. Remember, now this is the medicine, and I am telling you will get the best possible result prescribing this medicine. Diabetic ulcer with this, no clear-cut pathology, sometimes better by heat, sometimes keeping it open, sometimes covering, extreme excitement or the despondent, arsenic album. Remember, Solenum nigra. Please go through, and in clinical practice it will help a lot. It will get lots of name, fame, reputation, money, honey, everything with this single medicine, which can control lots of diabetic patients if it is a combined picture like this. Now, another neglected medicine, especially in pediatric cases, I am telling that overburdened study, overburdened book, leading to psychological upset, leading to gastric upset. The best indication of Calcarea floricum, please go through Boric Materia Medica. And Herring has told that overburdened children leading to neurological complication is Zincum metallicum. So, lots of symptoms, we can discuss, we can narrate. It is endless because, again, I am telling, learning, it's a continuous process, and most probably we have to be a forever student to help the human suffering in a better way. Thank you all, and nothing to say. I am really thankful to all the ex, present or the future NIH product, that hopefully we will do something conjointly to treat the human suffering. Thank you all. Hello, video off na? শুনতে পাচ্ছেন নাকি? এটা কি বন্ধ আছে নাকি? হ্যালো, তোমার তো খোলাই আছে। হ্যালো, হ্যালো।
Thank you, Dr. Sarkar, for your illustrative lectures. You have begun why the tips, because the polycrest remedy, when it is coming and prescribed, but no effectiveness was observed, in that case, we sometimes turn towards lesser known remedies or rare remedies, such a drug which is usually not used by the physicians, and sometimes their characteristic symptoms are very much indicative and very much curative also. So the result come, and that way it is called as a comprehensive pointer tips. Comprehensively it is the medicine which is very effective one, and so it is called as a tips. Like that it is generally called that the tips are used in clinical practice, and these tips are only coming when we know the medicine very well, we study it critically, comparatively, and then only we can judge the effectiveness of. And especially Dr. Sarkar has given us the examples of various medicines, and they are how they are comparatively being studied with the one or two symptoms, and how then it is differentiated. It's a very good idea. And so those who have opportunity to today hearing these lectures, they will be finding how to study the homeopathic Medica at home, how to study the rare medicine specially, and how to differentiate, compare with the other remedies very precisely. Because unless we comparatively differentiate each and other, then it is difficult to practice, and especially to select the medicine. It maybe you can select, but may not be useful, effective one in our practice. So, for successful practitioner, you must have the study mathematical regularly and go through and comparatively. It is must. Then only you can achieve some greatness of in prescribing. Thank you. I am thankful to Dr. Kalyani, thankful to again to Sir Dr. Sarkar, and thankful to thankful to our inaugurator, sir, and then thank you to General Secretary Bidyut, Dr. Bidyut, and so the other persons who are in the background. to conduct and to present this one very much effectively. And I hope again in the next our presentation would be definitely to raise in a high scale, no doubt, and it will be appreciable by all. Thank you once again.
Uh, Thank you, sir. There is a question from HMCH seminar. I don't know to whom it's addressed, sir. I have patient with symptom eructation after touching or pressing the head. Is there any medicine for this symptom? Orko, can you highlight this question on screen? Orko, can you highlight this question? There is a question from HMCH seminar in the live chat. Sir, I have a patient.
Yeah, I
Orko?
am listening. Better listen again.
স্যার আপনার জন্যই
Yeah,
বোধহয় the question.
I'm telling, actually, only touching the head, I think there is no rubric in our repertory, but touching the painful parts, relaxation is there, that is borax. I have because if painful parts touching causes relaxation, the only medicine is borax. Okay, and just for here, that time I forget to mention the medicine which has a special affinity for the common bile rat, Astacus fluvitis. In autopsy, it has shown that after proving it has produces lots of tumor on the common bile duct.
Okay, sir.
Okay, just for you, and it is one of the
Thank you, sir.
Okay.
Any therapeutic, sir, there is another question from Dr. Anand Tanvania. Tanania. Any therapeutic for low sperm motility?
That is something else, but we can think of Widnia somnifera and Sosuria lappa, but constitutional medicine, Thuja, Staphysaceae, so many things. Why it is, that is the more questionable, more important. Okay. But Sosuria lappa and Widnia somnifera, along with Thuja, Staphysaceae, Medorinum, Lycopodium, but these two medicine has a special affinity to improve the sperm count. Okay, I think that is enough for night. Hopefully we will meet again.
Thank you so much. Thank you so much. I like to thank, I'm waiting for Pralay also. We have so many stalwarts from NIH and NIH course which had run since 1979 till 1990. With 10 batches through and through, we are still waiting for so many things to learn from our seniors, as well as share the experience of the juniors. So we like to thank so much Dr. Sunirmal Sarkar sir, who has given a spare time for us. We like to thank our president, Dr. Degenerative Kalyani sir. He had been instrumental in continuing on with this CME program since day one. And I now have with me Dr. Pralay Sharma to conclude tonight's session, being the inaugurator and to conclude, which has been done regularly by Kalyani sir, but today he is the speaker.
Thank you so much, Bidyut, our secretary, Dr. Mukherjee. In fact, it went very well. And for 2 hours, 4 minutes, we have been continuing this. And today we are very lucky. The entire Alumni Association is very lucky to get the speaker like Dr. Kalyani and, of course, the speaker like Dr. Sunirmal Sarkar sir. And the moderator like Dr. Swapan sir, which went very wonderfully well. I believe that this discussion was very important and precious. and this discussion will be kept in the YouTube. I would like to thank them, those who have witnessed this today's 68 CME, and I would like to thank them too, who will be watching in future. So on behalf of National Institute of Alumni Association, I would like to thank each and every person, each and every alumnus, each and every faculty members, each and every speaker out here who had joined earlier and will be joining in future. On behalf of Alumni Association, I would like to thank them, and I wish that the participants will be much more to participate in near future in the CME online program. Thank you, Dr. Bidyut Mukherjee. Thank you all.
Thank you so much, Dr. Pralay. I forgot to mention about our sir, Dr. S.K. Day, who is the chief editor of our online journal. Sir, on this platform, I'd like to request you to say and a few words about our online journal. The second issue is to be published within few months. Yeah, few of your words on the journal, please.
Hello. Hello.
Yes, sir.
Our second issue is fixed to appear in month of May after the Hanuman's birthday, and our priority would be like that. It will be dedicated to Hanuman's birthday occasion. So the second issue would be in the month of May, and it will be dedicated to our Master Hanuman. And so we will try to have some critical write-ups for the presentations, and other article will be also. We will consider those articles we could not publish in the first one, so they will be on the priority. At the same time, we are requesting to all NIH alumnus to send some important article to us, because if we get a new, whatever we got earlier, out of that how much we can have, accordingly we have published, and there are some selected one, it is with us. We will try to present that one in this, and at the same time we are inviting for a fresh article, and that fresh, out of fresh article, we will take someone in this number 2 issue, and rest of them will be for the third issue, which will come in the month of December. And I hope all those who are interested to write the article, they can see the instruction to the authors, which is available in the website of our alumnus. So please go there and see and download and read it carefully and follow the instruction to write an article proper way. So the ultimately those who are in the review committees or those who are processing that with the corrections and revisions and other things, so that can be easily be done, because first time we were not able to give proper instructions, so we had some problem. We cannot give a 100% very strict rules for editing and others, but even then we tried to consider smoothly and very much leniently also. Anyway, my request, please come up with the new writings, with the writings not only on the present days, present scientific knowledge as a review literature, you can submit. You can submit also on Hanuman's work and activities which is known to us or which is lesser known to us. So please go through and thank you.
Uh, Thank you, sir. There has been a question to Dr. Kalyani, sir, and Dr. Sunirmal Sarkar, sir, three questions. Also, can you kindly highlight the question? Yeah. What are the special homeopathic treatments for FOP? And second is, what are the homeopathic treatments for MPP? Maxicule Albright syndrome. C for Dr. Sarkar. Sir, when would you publish Just You Think book, 3 volumes? Okay, so these are the 3 questions. Sarkar sir had got disconnected. Uh, for Kalyani sir, question 1 and 2 is for you, sir.
What is FOP? Is not clear to me. Can it be cleared?
Prabir Mojumdar sir, if you are listening to us, if you are online, please write what you meant to say about FOP. The second question is, what are the homeopathic treatments for McCune-Albright syndrome?
This is also not clearly known to me at this moment. I
Okay,
will
we'll
try to
try
search.
you. We'll try to
But
get back to
one thing I can tell you that symptomatic diseases are more convenient for homeopathic treatment. More it is syndromes, more it is multisystemic. Symptoms are the only guidelines. Their homeopathy is free and comfortable to treat any type of symptom.
Okay, sir. Thank you. Thank you so much. With this, we end tonight's program. We, with the permission of our senior most sir, Dr. S.K. Day, we are returning back to the backstage editor.
Sure,
Dr.
sure.
Day, sir. Thank you, sir.
Yes.
Good night to all.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed, please do share. Do give us a like. Share this video to all other fellow homeopaths and everyone possible. Thank you.